In many ways, sleep is like medicine. It's absolutely essential for so many of the functions of our mind and body. We need to be able to sleep in order to learn new information, process that information, and form new memories. We need it to be able to concentrate the next day, and in order to be able to regulate our emotions and our moods as well. But we also need sleep for our immune system and for our cardiovascular health and our metabolic health. So that's why in this session, we're going to talk about sleep hygiene and how to sleep better. So the interesting thing about alcohol is that very often people drink because they're having difficulty sleeping. But again, it's a vicious cycle, because what actually happens when you drink, although you get this initial sedation, it actually has an activating effect afterwards. So you don't actually stay asleep. And the sleep that you do have is less restful. There's less REM cycles. So it's really, the quality of the sleep is not so good. So it's a bit of a vicious cycle where alcohol is both the cause and the consequence of sleep deprivation. So I'm going to give you 10 top tips to help with restoring your sleep. So my first tip is to be consistent. Set yourself a routine where you go to bed at the same time every night and wake up at the same time every morning, even at the weekends, even on days off. And the reason why this is my recommendation is because you have something called the circadian rhythm, and this is the rhythm of hormones in your body like cortisol and melatonin, which help to regulate your sleep-wake cycle. If you distort the times that you go to bed and the times that you wake up, you're distorting this circadian rhythm, and it becomes more difficult to create a regular sleep-wake cycle. So my top tip is to, one, set notifications on your phone to remind you to go to bed, and try and wake up at the same time every morning. And this is one of the most beneficial ways that you can help to regulate and have a regular sleep-wake cycle. My second top tip is to make your bed a sleep-only zone. The reason why I say this is because many of us have bad habits where we do a bit of work or admin in bed, or even watching television, watching kind of horror movies or kind of really tense psychological dramas. And when we do this, we change our sleeping space from a sleep-only zone to an environment where we might be stressed or anxious, or our mind is working on overdrive, thinking about kind of work the next day. And actually your bed should be a safe space where you're conditioned that it's part of your habit that this is a safe space for you to sleep, and it's a sleep only space. And again, that's one of the other things that will help to kind of set a bit of a routine, structure and boundaries with your sleep wake cycle. Tip number 3 is get up and try again. If you have been lying in bed for 15-20 minutes, if you still can't sleep and you're starting to get those ruminating thoughts, thinking, I'm never going to be able to get up in the morning, this is hopeless, my top tip is actually to get up and go into a different zone, go into a different space, maybe sit in the couch, make sure the lighting is nice and dim so that you're not going to be overstimulated, and actually you're not kind of putting more blue light into your eyes, so not looking at screens or your phone, your laptop, but actually doing something calming, relaxing, maybe reading a book, maybe having a warm drink, but take yourself away from your bed and go to a different zone, a different area, get up and try again, and then returning to your bed with a new fresh mindset. And that's another thing that a lot of my patients tell me really helps and works for them. Now, this one might seem really obvious, but my next tip is to avoid caffeine. Caffeine stays in your system for quite a long time. So my advice is to stop drinking caffeine by 12 noon. If you're struggling to sleep, don't drink any more caffeine or consume caffeine after 12 noon. Caffeine's actually a really powerful drug in our brain. It blocks a neurotransmitter called adenosine. And what happens during the day is we build up this neurotransmitter called adenosine, and it applies like a sleep pressure on our brain. So this buildup of adenosine during the day, it gradually tells our brain that we're tired and that we're sleepy and that we need to go to bed. And then as we sleep, we clear that adenosine, and then we wake up in the morning feeling refreshed and awake. But if you drink caffeine, what caffeine does is a bit like a blindfold to your brain, where it blindfolds your brain from recognizing that adenosine. So there's much less sleep pressure if that makes sense. When you drink caffeine, you actually don't make yourself any more awake or feel any more refreshed. You're actually just delaying that response to the adenosine, because it's like a temporary blindfold, and the adenosine that applies this sleep pressure is still there. You're just with caffeine, you're just applying kind of this kind of temporary blindfold. So that's why, again, it's really a short fix to drink caffeine during the day to keep yourself more awake. And then it can disturb your sleep at nighttime. Also, just to remember that there's caffeine in all sorts of drinks as well, not just coffee. So things like fizzy drinks, tea, and actually even in chocolate as well. So there's lots of other products that have caffeine and medications. So always just check the labels, and don't underestimate the impact of caffeine on your brain, and even in terms of how early you might need to stop drinking caffeine, because it does last for a long time in your system. Now, next of all, I'm going to tell you not to nap during the day. And I know that sounds really mean of me, because who doesn't love a nap? And it can be really tempting sometimes, especially when we're really exhausted and really tired. But again, do you remember I was talking about adenosine, this neurotransmitter that applies sleep pressure and that makes us feel sleepy at nighttime? Well, when you have a nap, what you're actually doing is you're allowing your brain to clear that adenosine. And so when it comes to later on in the evening, there's less of that adenosine to tell your brain to fall asleep. And so it's going to be much harder to fall asleep at nighttime. And again, we talked earlier about those hormones, that circadian rhythm, and most of us have a 24-hour sleep-wake cycle. But when we have a nap during the day, it distorts and disturbs those hormones, which like cortisol, melatonin, adenosine, which should be following a regular 24-hour pattern, and having a nap in the middle of the day just distorts that. So it's really difficult, but my advice is to push through and distract yourself with something that's going to wake you up. Maybe go for a walk, maybe call a friend, do something that's going to engage you and wake you up, and resist that temptation to have the nap. My next piece of advice is to develop your own sleep rituals. And you can think of this as a bit like a treat or a reward. Some of the suggestions I have are things like lighting a nice candle before you go to bed, maybe having a warm drink, maybe it's taking your makeup off, maybe it's kind of folding your clothes beside your bed. But the reason why I'm suggesting this is because it's about creating this routine and a bit of a structure that's kind of helping you to gradually wind down at the end of the day. It's a bit like if anybody has children here, or nieces or nephews that they look after, it's all of these subtle signs and cues that we use with our children to tell us that actually, look, we're winding down, it's time for bedtime, and it's just getting us ready in that mental zone to sleep. No more exciting stimulation. It's about winding down, giving ourselves a little bit of self-care, and getting ready to go to bed. Top tip number 7 is bath time. So the reason why I would suggest maybe having a bath before bedtime if you're really struggling to sleep is because, one, it's really relaxing. It's an opportunity to use nice things like lavender oils in your bath to help you to relax and unwind. But the other thing as well is when you have a bath and you come out of the bath, your body temperature on your skin surface will drop slightly. And researchers have shown that when our body, in order to fall asleep, our body temperature, it's easier to fall asleep when our body temperature drops slightly. So when you have a bath and then you come out and your skin's damp, your skin cools, and it's a little bit easier to fall asleep. The other thing actually is just think about the room that you're in as well, making sure that it's not too hot or stuffy, that your bed covers are not too heavy or not too light, and actually just making sure that the room is at the right temperature, and a slightly cooler room will help you to fall asleep. So that's my next tip is bath time and also room temperature. Top tip number 8 is stop checking the clock. I think a lot of us can relate to this when we're lying in bed and we can't sleep. We automatically look at the clock next to us, or even worse, looking at our phone and looking at the time on the phone. And the reason why this is really something to try and avoid doing is it creates this opportunity for us to have these negative thoughts, automatic negative thoughts, thinking, oh no, I'm not going to be able to sleep. Start to worry about, if I don't sleep, then I'm not going to be able to function at work tomorrow. If I don't function at work tomorrow, I'm not, it's just going to be a disaster. I'll get fired, lose my job or whatever, or it's just going to be really stressful. And so if we check the clock frequently during the middle of the night, it's often a common trigger that creates a spiral of other negative thoughts. Often when people have got anxiety disorders, there's a tendency to have checking behaviours with the hope that it'll create this kind of false sense of reassurance. But often, again, it makes things worse, and we create these vicious cycles where we keep checking the clock. It makes us worried, so we don't sleep. And then because we're not sleeping, we then check the clock again. And so again, it's an opportunity to interrupt that vicious cycle. And so again, my advice is when you're lying there in bed and you have that temptation to check the clock for reassurance about the time, or some people call it fishing for misery, where you're actually kind of looking out for the bad news as well. You're fishing for that misery. Just resist the temptation. Acknowledge that you are worried about the time and you're having these worried thoughts. Acknowledge that they're there. Accept them. Don't try and fight them. And maybe distract yourself with a breathing exercise or one of the mindfulness tools that we use in our Urge toolkit. But tip number 8 is don't check the clock. Number 9 is to keep a sleep diary. So if you were to see a one-to-one cognitive behavioral therapist or a sleep specialist, this is absolutely one of the things that they would ask you to do. So across the week, they would ask you to try and record or notice what time you're going to sleep at nighttime, and also what time you're waking up in the morning, and any interruptions to your sleep, and just to record that and write that down. If you've got a wearable device, it might do this for you automatically. But it's an interesting exercise to do, because as well as kind of noticing and keeping track of your sleep, it gives you this opportunity to see anything else that might be interfering with your sleep. So do you sleep worse on days that you've drank alcohol, or days that you've drank coffee, or on days where you've exercised very late in the evening or worked late in the evening? Or is there specific days of the week that are worse than others? It gives you this opportunity to really understand what the different factors are that are impacting on your sleep. So it can feel like hard work. It's a bit of a time commitment, but if you're really struggling with your sleep, it's absolutely worth doing. So tip number 9 is keep a sleep diary. And finally, tip number 10 is to exercise and eat well. So again, this might sound obvious, but during the day, if we do a little bit of light exercise, it helps us to feel a bit sleepier at nighttime. It means that we're less likely to be taking naps. But the other thing as well is if we're exercising, and when I say exercising, actually, what I really mean is moving your body. Exercising can sound really quite unappealing at times. I tell myself to move my body. So for me, that means going for a walk or experimenting with ways of moving my body that I enjoy doing. Maybe it's Pilates for you, or maybe it's going jogging, but whatever works for you, moving your body. And the other thing I would say about moving your body is if you can do it outside when you're exposed to sunlight, even better. Because when you're exposed to sunlight, again, it's one of the things that helps to tell our bodies that and tell our brains that we're exposed to sunlight. It helps to regulate those circadian hormones as well, so that when the sun sets and we're not exposed to sunlight anymore, that we're ready to sleep. The other thing, as well as exercise, is thinking about the food that we eat. So it's a bit of a balance, because you don't want to go to bed hungry. And because if you're hungry, it's going to be difficult to sleep. But if you go to bed with a really full stomach, that's another thing that research has shown. It makes it more difficult to fall asleep at nighttime, and you could be restless, especially if it's really sugary food, or kind of like foods that are going to make us kind of give us heartburn or indigestion. So really spicy foods, or again, of course, like alcohol, caffeine. And if you've done a sleep diary, again, these are the kind of other factors where you might start to see the relationship between how you exercise, when and where you exercise, and what you eat as well, and how those things can affect your sleep-wake cycle. So my top 10 tips for good sleep hygiene, getting a better night's sleep, is 1, be consistent with the time that you go to bed and wake up. 2, make your bed a sleep-only zone. 3, get up and try again. 4 is avoid caffeine or nicotine before bedtime. 5 is no naps during the day. 6 is to develop your own sleep ritual. 7 is to maybe think about having a bath, but make sure that your room is the right temperature. Number 8 is stop checking the clock. Number 9 is to keep a sleep diary. And finally, 10 is to exercise and eat well.